we are going to address the dangers of procedures that are on the rise, chemical abortions. Also called medication abortion or abortion pills, a chemical abortion is a non-surgical abortion in which a mother takes pills containing mifepristone and misoprostol to end the life of her baby. The pro-abortion Guttmacher Institute reports that chemical abortions accounted for nearly 1/3 of all non-hospital abortions in the U.S. in 2014. The first trimester procedure has been on the rise over the past 2 decades. To give us even more insight about the dangers of chemical abortions, we are joined now by Dr. Donna Harrison, the Executive Director of the American Association of Pro-Life Obstetricians and Gynecologists. She's also an Associate Scholar with the Charlotte Lozier Institute and joins us now from South Bend, Indiana. Dr. Harrison, thank you for being on the show.
Thank you for asking me.
First off, can you explain to us exactly how a chemical abortion works?
Sure. When a woman is pregnant, her body produces a special hormone called progesterone. And that progesterone changes the lining of her womb so that she can carry the baby and feed the baby. And that progesterone is very important for all the changes that make her body able to carry a pregnancy. Mifepristone, Mifeprex, the first drug that's used in the drug-induced abortion procedure, blocks progesterone. So it blocks the ability of the mom to feed her baby. And that's how it causes the baby to die. But Mifeprex doesn't cause the uterus to contract. So the mom will have a baby who's died, but in order for her womb to push the baby out, there's a second drug given, which is misoprostol, also known as Cytotec. And that drug causes strong contractions, strong cramps, which causes the woman's womb to push the baby out. And that's how it's done.
Dr. Harrison, what are some of the health risks for the mother specifically associated with a chemical abortion?
Well, we know that both Mifeprex, the first drug, and misoprostol, the second drug, are both immune suppressant drugs. They both can suppress the immune system. And that's how Holly Patterson of California, a beautiful 18-year-old, died within 2 weeks of taking the abortion drug. She was perfectly healthy before, and then after taking the abortion drug, she died of an overwhelming infection called Clostridium sordelii. There have actually been over 8 women who have died from this. The other risk is that Mifeprex, the first drug, also makes it harder for the uterus to stop bleeding. So many women have had a very large hemorrhage afterward, after taking the Mifeprex. And that's one reason why the clinical trials were actually halted in Iowa when they first came out, because one woman lost over half of her blood volume.
Dr. Harrison, what should our viewers know about abortion pill reversal?
Well, abortion pill reversal is based on the simple principle of when we know where a poison works, we give an antitoxin. So we know that Mifeprex, the first drug, works by blocking a special place on a cell called a progesterone receptor. But we also know something else about Mifeprex, that blockage can be reversed. So Mifeprex can be kicked off that receptor if you have enough natural progesterone around. And natural progesterone has been used in the infertility industry for over 50 years. We use it in women who are threatening to miscarry. We give them extra progesterone to help them stabilize the lining of their uterus. So we know that natural progesterone is safe in pregnancy. And there's been a study where there's over 300 women who have had babies after abortion pill reversal, and there's more on the way. And we know that this drug works. We know it's safe in pregnancy. There's been no increased risk of birth defects in those women who have had the abortion pill reversal. So the most important thing you could take away from this interview is to tell your family and friends that, hey, if you've made a mistake and you've taken the first drug, Mifeprex, there's hope. You can reverse this, but time is of the essence. So you have to be within 72 hours of taking the drug.
That is so important. And finally, Dr. Harrison, I know you were recently involved with a new documentary from Life Issues Institute called A Closer Look at the Chemical Abortion Pill. Tell us about it.
Well, that was a really great video that was put together by Brad Mattis of the Life Issues Institute, and he interviewed women who had had Mifeprex abortions, just so that the women themselves could speak. Because right now, what everybody hears is the abortion industry spin. We hear that, oh, pop a pill and poof, the pregnancy is over. But that's not the reality of it. And these women speak. I just can't speak highly enough for this video. These women speak about their own experiences. And abortion by a drug-induced abortion, by Mifeprex and misoprostol, it's painful. You can bleed for weeks. You can have cramping all that time. Most of the time, cramping serious enough to require narcotic medication. And you cannot predict when this abortion, when you're actually going to pass the tissue. So you could be at the office, you could be in the elevator, you could be driving. It can sometimes take days, sometimes take weeks for all of the baby and the placenta to pass. So this video helped to unmask the lies, the spin that's around chemical abortion.
Dr. Donna Harrison, the Executive Director of the American Association of Pro-Life Obstetricians and Gynecologists, thank you.
You're welcome. Thank you.
Joining us now in our D.C. studio is Marilyn Musgrave, a former U.S. representative for the state of Colorado and now the Vice President of Government Affairs for the Susan B. Anthony List. And joining us via Skype is Brad Maddist, the President of Life Issues Institute and the creator of the documentary A Closer Look at the Chemical Abortion Pill. Brad, first off to you, why did you deem this topic worthy enough to dedicate a whole documentary to?
Well, the fact that up to 50% of all abortions done are now done with chemical abortion, and it's being sold as a safe, easy, near painless procedure, and it's not. And the experiences of women who take this drug, who are vulnerable victims, is just a tragedy. And I wanted to give voice to them and warn other women about what has happened.
Congresswoman, why do you think there's so much pushback to the science and success of abortion pill reversal?
Well, first of all, there's always pushback if there's any restriction on abortion. And this, of course, is interrupting an abortion. And they want, the pro-abortion crowd wants women to be isolated and to do this in private. You know, boy, there's not going to be anybody praying on the sidewalk if you're having a chemical abortion. This interrupts that abortion, and it is very sound treatment. It's very proven. But they don't want to acknowledge that the abortion industry does one thing, and that's taking the lives of innocent children. This is like a dose of reality. And furthermore, women regret, there's regret involved with abortions. There's also, we know now there are abortion survivors. And you know, if you really wanted choice, if you were being intellectually honest, you would say, yeah, a woman has a right to change her mind. And I just think this documentary is so important because women do want to change their mind. And if you go to a website, sometimes you'll look at the frequently asked questions and you will hear the desperation of a woman. Is it too late? Can I still change my mind? And boy, I tell you, that really touched my heart when I read those things.
Absolutely, and there is hope there. Abortion pill reversal is possible. And it's so important to discuss. Brad, when putting together this documentary and doing the course of these interviews, what was the most important thing that you learned throughout the course of this project?
Well, the sheer number of abortions, the percentage that are done with chemical abortion, the ease with which they sell it, and the overwhelmingly horrendous experience that women have is really shocking.
It absolutely is. And finally, Congresswoman, from a legislative standpoint, where are we when it comes to legislating and restricting chemical abortions? It happens earlier on in a woman's pregnancy, so does that make legislation more difficult?
Well, I think what we need right now, since we don't have a pro-life majority in the House of Representatives, we need Congress to give a clear message to the FDA. I mean, they're under Health and Human Services. Their role is looking out for the health and safety of the American public, you know, looking at drugs and their effect and you know, a myriad of other things. But this is a very appropriate role for the FDA. And when Brad is talking about, you know, chemical abortions on the rise, well, then you have organizations that will give a woman an abortion after an interview, and the drugs come from India. Now, do we want the FDA looking out for the American public, their safety? Of course we do. And Congress, who controls the power of the purse to fund these departments, these agencies should give clear instruction to the FDA. And I don't care whether you're pro-life, pro-choice, you ought to realize that drugs coming from India, whether they're for hypertension or whether they're chemical abortion drugs, I mean, they have no place coming to our citizens in this country. We have no guarantee of what are in these drugs.
We absolutely need to get this information out there. I'm so grateful for you both for being here. Brad Mattis, President, Life Issues Institute, and Marilyn Musgrave, the Vice President of Government Affairs for the Susan B. Anthony List. Thank you both.